Again, welcome to everyone to this afternoon's webinar on caring for a loved one living with dementia and doing the most important thing, doing that while taking care of you. My name is Kathleen Farrell. I work in UW Human Resources. I coordinate work-life programs for the university, and that includes events like this one, designed to support colleagues who are caregivers. And this is a topic that's very near and dear to my heart. And I appreciate what it takes to make time to be here to support yourself and in order to support your family. So thank you. A special thanks also to the whole U. You see the slide up on the screen. They are amazing partners in making these opportunities available to the UW community. So thanks to that team for making today's event possible. Recording of today's session will be on the whole U website in the next few days, and we'll send that out to everybody here so you have that link to share. Two quick notes of housekeeping. You may have noticed that we are recording today's session. You're muted and your video is off, and we'll ask that for most of our time together you leave it that way. It just helps to focus attention on our presenters. But when we get to Q&A, if you want to unmute yourself and raise your hand, we'd love to have you chime in and be a part of the conversation. So with that, I'm going to get us started. The flow for today is very straightforward. We are incredibly fortunate to have two UW experts with us this afternoon, Dr. Susan McCurry and Dr. Tatiana Sedek, who are from the UW School of Nursing. And both of them bring significant experience supporting individuals living with dementia and experiencing cognitive impairment, and most importantly, supporting their caregivers. I'm going to give you just a tiny little bit of background about each of them. And then Susan and Tatiana are each going to tell you a little bit more in their own words about their work, maybe share a little bit about what they're seeing and hearing right now in their work with patients and with caregivers. And when they're done telling you a little bit about themselves, we're going to open it up for question and answer. Please put your questions in the chat at any time. We'll be keeping track of them. I know some of you submitted questions ahead of time, and we'll be sure to work those in too. So allow me to introduce our wonderful colleagues. I'll start with Dr. Susan McCurry, who is a research professor in the School of Nursing and also an adjunct research professor in the Department of Psychiatry and Behavioral Sciences. Susan is a clinical psychologist who specializes in gerontology and geriatrics. She has 25 years of research and clinical practice that is focused on developing and evaluating interventions to improve the quality of life for persons with cognitive impairment, including, very relevant to our conversation today, efforts to build caregiver resilience. So thank you so much for being here, Susan. And I'm also going to give a brief welcome and overview to Dr. Tatiana Sedek, who is the Rasmussen Merrily Endowed Associate Professor and also Director of the Graduate Education Program in the UW School of Nursing. Her research brings into focus issues that are relevant to patients living with dementia and their family caregivers. Tatiana is dedicated to identifying ways to optimize care for persons living with dementia and helping to educate and support their caregivers and healthcare workers. In addition to her work at the University of Washington, she maintains a clinical practice because it gives her opportunities to learn with and from her patients and to be a witness to their recovery and their progress toward well-being. So we are so thrilled you are both here and making time to share your expertise. And Susan, I wonder if you would be willing to get us started by sharing a little bit more about yourself.
Sure. So thank you very much, Kathleen. I appreciate being here with you and everyone that's joined us. As Kathleen mentioned, I am a clinical psychologist. I'm a research professor at the University of Washington School of Nursing, but I also have a small private practice that I see clients, including caregivers and persons with cognitive impairment. I work with AAA's, area agencies on aging throughout Washington and Oregon, also in Illinois, to help their staff members develop and translate evidence-based training programs for caregivers that they're serving in their communities. And I'm involved in working with caregivers as part of the Adult Changes of Thought study at Kaiser Permanente. So I see caregivers in a lot of different places, in a lot of different roles. And Kathleen had suggested maybe I might mention some of the unique circumstances that I'm seeing since COVID hit that are particularly impacting caregivers. I noticed that there have been issues related to helping persons with cognitive impairment follow all of the rules that we need to do to stay safe during the era of COVID. So to remember to wash their hands, to understand why they have to wear masks, to not take the masks off when they're in public. Uh, the social isolation that the caregivers and the people they're caring for are experiencing has been very difficult for many of the folks that I'm working with. Uh, not only are family not able to come and visit, but if there has been in-home assistance or adult day programs that the cognitively impaired individual's been attending, they can't do that now. The caregiver now is with the person with dementia 24 hours a day and is having to keep them engaged and activated in ways that are much more difficult when they don't have support. The other things that I notice is caregivers are having a hard time taking care of themselves because they can't get the respite breaks. They can't get away to find time and take care of their own needs and self-care issues, and feel a little bit guilty if they do try to step away. So one of the other things Kathleen had asked is are there any misperceptions about COVID that I've seen? And one of the things that I've noticed is this notion that, well, it doesn't matter that I'm not able to go and visit my grandmother or my mother these days because she's got cognitive decline and she doesn't remember when I come anyway. And I want people to really understand that if there's any way to continue to connect with the older adult who has dementia, even in the era of COVID, you want to try to do that, because social isolation, it's becoming clear, is as much of a problem as COVID itself in terms of the impact on neuropsychiatric conditions and well-being that it has on the older adults who are now so alone in many cases. So I guess I'll just stop there, see what Tatiana has to say.
Thank you, Sue. So my name is Tatiana, and as Kathleen mentioned, I do work in academia, but my sole calling is a clinician. So I maintain a clinical practice where I see people who have unusual presentations of dementia, so unusual symptoms of cognitive impairment, behavioral, neuropsychological symptoms, and a lot of medical issues. And my goal in my clinical practice is to help stabilize them and to help their family members and friends really set a routine of self-care that they can maintain. Having said that, this clinical practice really informed a lot of my academic work. So last few years, the focus of my research was on finding ways to help family care partners, family members and friends of people who are living with dementia, develop self-care strategies that they can maintain. What we learned from the literature and from some of our studies is that self-care is the first activity that kind of gets dropped out when a care partner or person with dementia are in crisis. A care partner may have a fairly good self-care routine day to day when things are calm, but when there is a health crisis, emotional crisis, pandemic, what would you, any type of crisis, self-care is kind of the first one to be given up and to let go. So we just completed a very small pilot study that had very meaningful findings. We were looking at different theories of behavior and behavioral activation with the goal of finding out how can we help care partners develop self-care routines. And what we've developed a measure called Managing Your Own Wellness, or MEOW. And this measure contains 33 different self-care tasks that are divided onto universal, what you need to do to survive, eating, drinking, sleeping, and then kind of more of a kind of pleasureful, fun activities. But one of the most important domains of this measure is self-care related activities that really has to do with caregiving responsibilities. So what type of self-care do you do in order to be able to maintain taking best care of your loved one that you can? What we found in our work is that it's this reframing where it's not self-care for self-care's sake, about self-care in order to manage better and in order to sustain your caregiving responsibilities over time and to be able to show up. So what we found with this very simple intervention is that in just 5 minutes a day, in as little as 4 weeks, we are able to guide people in developing very small habits that they can build into sustainable self-care practices. So right now we are partnering with our colleagues in the Department of Human-Centered Design in developing quite elaborate software program where using a tablet, computer, or phone, care partners can actually use technology to engage to maintain their habits. So this kind of has been a highlight and an interest for me because as part of this pilot, you know, the first thing we ask care partners, how did your self-care change since the pandemic? And pretty much everybody's saying what self-care, you know, this whole definition of self-care becomes obliterated when you are responsible for your loved one 24/7. And I guess my message is that self-care is absolutely necessary. It's much more necessary now than even before, and that it's feasible to engage in regular self-care. And, you know, we have science that can help support people in doing that.
Oh, thank you both so much. And as you were talking and I was reflecting on my own experience and conversations with friends and colleagues who have been caring for a loved one with cognitive impairment, it rings true. And I think, Tatiana, you said in your research, the first thing that tends to go for caregivers is taking care of themselves. Like, we know it's so important, but it's the first thing to go when life gets busy. And Susan, you shared that right now, respite isn't as easy to access. You know, we can't get backup support for ourselves. And so I wonder if we can hover in this space for a little bit. We know that taking care of ourselves as caregivers is important. Right now, it's hard to bring somebody in to find time to be able to get away. Um, what is some advice, like some concrete advice you might have for folks in the room, either for dealing with the guilt or just concrete ways that you can recharge yourself in ways that are meaningful for yourself and for the person you're caring for?
You know, one thing that occurs to me, and Tatiana might also have information about this that I don't have, but I know the Dementia Action Collaborative has been putting out a newsletter every month with resources for family caregivers of people with dementia during the COVID-19 outbreak. And it's a tremendous resource. The March issue, it was 7 pages long, single spaced, with links to many relevant handouts, webinars, virtual support groups, community programs, some activities that persons with cognitive impairment themselves can engage and enjoy, but also that the caregivers. What I don't know, and I'm hoping Tatiana does, is how one can get on a mailing list for that. I'm on a mailing list because of the work that I do with the AAAs. But when I looked at the newsletter that came out most recently, I didn't see a place that someone could sign up. So Tatiana, do you know?
You know, I'm not sure how to get in a mailing list, but before the end of our time today, I will try to look it up and let you know. And if not, I can send information to Kathleen and she can add it to the listserv for people who are attending the webinar today. So yes.
I can certainly send the March issue to Kathleen. And so you'll have that and people could see as an example of what I'm talking about.
It is a wonderful resource, and I want to tell you kind of what's in store, what the collaborative and the Dementia Action Collaborative is an outgrowth of State of Washington plan to address Alzheimer's. You know, each state developed a plan of basically surveying what are the gaps and what are the opportunities to improve care and support infrastructure. And Dementia Action Collaborative is now in charge of implementing our state plan. So there's a lot of activities going on, and in the next month or so, some of the upcoming things that Collaborative is producing is a very easy to use but comprehensive legal toolkit for helping people really understand how to take care of legal paperwork and what legal issues are important to attend to when you're a caregiver of an older adult, especially older adult with cognitive impairment. We're also completing a palliative care roadmap that would basically list how do you get palliative care support and resources, and explains what palliative care is and why people with dementia should and do qualify for palliative care resources. And a third that we're working on right now that probably going to be done closer to beginning of summer is we're developing a toolkit for caregivers for care transitions. We are updating materials that Alzheimer's Association developed but kind of retired a few years ago on teaching families how to collaborate with healthcare providers in truly getting their questions answered, in making sure that they get the direction that they need for managing complex care at home, and really helping care partners understand what role do they need to play and how to be active member of care teams during care transitions. So this is just a preview of things to come from the Dementia Action Collaborative, but we'll figure out how to link you to that resource.
Great. And I know we focused a little bit on that specific resource. Is there anything else in terms of just kind of concrete tools or practices or advice? Again, that notion of guilt, number one, getting past that. And then number two, once you do, what are some things that might be helpful in terms of, particularly restoring ourselves during this time?
Great question. For me, this is really about reframing, and having worked with caregivers for a long time, it's kind of incredible how, in our mind, we have certain kind of cognitive areas, kind of certain stories we tell ourselves. And especially if you come from a culture where caring for yourself is not okay when you take responsibility for caring for somebody else, I think we're seeing a lot more manifestations of guilt. But I think all of us, to some degree, once we take on a role of a caregiver, we think we have an honor and a privilege to caring for somebody else. Therefore, my needs has to come to the background. And this is when you're caregiving for your children and for adults who need your help. So I think what helpful that I see with patients in my practice is to really reframing, how can you take care of yourself so you can take best care of your loved one? Where taking care of yourself becomes a necessity for your survival, becomes your social responsibility. Because if you are taking on caregiving for any period of time, you understand that to maintain it, you really need to have reserves. And if those reserves get tapped out very quickly, then both you and your loved one are at risk for crushing. So having this reframe that self-care activity is not a selfish thing, but it's absolutely necessary for survival, I think is number one. Number two is to have goals that are meaningful. I cannot come and tell Kathleen what her self-care goals should be. Kathleen needs to do a bit of an inventory. So this is why in our research, this is what we do. We create an inventory of self-care activities, and we ask people, like, how often do you do it on a good day? And then how often do you do it when you're in crisis? And we put this side by side, and then the person looks and says, wow, like I can visually see how my self-care drops off. And it's very powerful. It's an intervention in itself. And then we say, what's really most important to you? What are the three things that most important to you? And once you identify those priorities, then we start thinking, how can you work towards them 2 minutes a day, 5 minutes a day, And we use the science of behavioral activation and goal stacking to guide people in eventually developing self-care habits. The idea is that if your goal is to work out 30 minutes a day, we'll start with getting your workout shoes out. Maybe you'll set them out for a week every day. Right after you pour your cup of coffee, we'll find one thing you do every day without fail, and we'll stack a little additional habit to that so you have a routine. And then we add to it, then we say, okay, now you put your shoes on, you get out. And you go out for 5 minutes, and people say, but I want to go for 30. And we say, go for 30, no problem, but go for at least 5. And then we kind of grow and nurture that habit. So I think reframing, identifying what's really important, and developing very small action steps is what I'm seeing really helping people, and doesn't take away time from their caregiving responsibilities.
Yeah, I really like that, Tatiana. I like to focus also on pleasant, meaningful activities. In addition, I think an important part of self-care is doing things that you enjoy, that you love. And again, you have to be realistic, and you have to focus on what's in your control under your current circumstances. But are there are there things that bring you pleasure and joy, and how can you incorporate those into your life, even just a little bit every day? So, for example, I know someone who has started writing letters to family members as a way of reaching out. She'll spend maybe 10 minutes a day drafting a little note and sending it off to someone. And now letters and cards are also coming into her, and it brings her pleasure to be able to connect with people in this way and have these that she can review when she wants. Doesn't take a lot of time, but it provides an interpersonal connection and brings her joy. I know someone else who invited her friends and family, if they were thinking of her, to drop by some flowers. And her house is full of flowers now because people, will just often stop by and drop off just something small that brings some color and freshness and life into the house. And so these little things that bring you pleasure and joy are so important. I also like the idea of trying to get people to do some relaxation mindfulness work. And you can do that in very small snippets. There are something called mini relaxation exercises that you can do sitting, standing, laying down, walking. And it's nothing more elaborate than taking a deep breath, saying to yourself, relax, and exhaling slowly, encouraging all of your muscles to relax over the next like 5-8 seconds. And then you go about your day. Takes almost no time at all. And yet doing that at multiple points throughout the day is a way of just sort of reconnecting again with a calmer, safe place within you. And so I encourage people to really try to find time for these mini relaxation or little pleasurable activities.
Yeah, those are great. And I think Tatiana mentioned earlier the idea of how do we stack self-care onto stuff we need to do anyway? And building upon what Susan just said, I shared care responsibility for my father with my mom at one point. And I remember like going to the mailbox was like maybe one of the few minutes when I could be alone, right? And just even while outside getting the mail, doing the four square breathing, right? Like literally a minute, but going to get the mail or going outside for that brief period of time, taking out the trash, right? Like, okay, I know that's a safe moment. How can I make that 1 minute better for me? Was great. Or when doing shift changes, like running from class to go help take care of dad, I would always stop and buy a cup of coffee because that coffee was really important when I was going to be on duty. And while I was waiting for my cup of coffee, like literally journaling for like a half a page, right? But that was, again, stacking something I knew I was going to do anyway as a part of my caregiver routine and build something into it that was serving me well. So some great concrete examples. And I see folks chiming some things into the chat. So thank you for that.
I want to quickly mention a couple of resources I added. So I added a list to the resources from Dementia Action Collaborative. So you can take a look at the COVID-19 resources and all the other resources and things that are to come. Their most recent March newsletter is posted on that website. Also building on what Sue said about mindfulness, this is if you can invest a little bit more time. I have a very favorite all free online 8-week mindfulness course that many of my patients who are caregivers take reluctantly because it's a bit of a time commitment. You have to do mindfulness exercises daily, but it's truly transformative. It teaches you many different mindfulness techniques. So at the end of 8 weeks, you can say, okay, this works for me. I'm going to stick with that, or those things are nice to know. And it's completely free, and you can take a year taking it. You can take 8 weeks. So I just sent a link there for you. And there are many different lists of pleasurable activities. You can kind of look them up. There are endless lists that could give you ideas of different pleasurable activities that you
There are
can
even lists
look
that
through.
say for COVID-19. If you search Google that way, you'll find them.
And for those of you, we will save the chat and send those links out when we send the video after today's session. So don't feel like you need to scramble to capture that information, but please share resources that you think are useful, everyone. I'm going to look, there was a question that popped up in the chat that also came up in some of the questions asked before we came together today, and that's around, how to address the issue of not being someone we love, caring for somebody who is in a memory care facility, for example, and given the restrictions that have been on family access and how quickly things are changing. Any advice to offer, either on negotiating with the staff at the center or using that time with our loved ones effectively and in meaningful ways?
It's an excellent question, and you have to be mindful that you're going to be kind of recreating the relationship right now when your interactions have been different, right? So if you were able to go in every day, and if your loved one maybe didn't recognize who you are, but knew that you were an important person, right now, last year during pandemic, most facilities will only allow you to come in once a week for 30 minutes or to see your loved one via, video conference. With most facilities in Washington State having already received vaccinations and starting to open up a little bit more for visitors, still the rules for social distancing is going to be in place. So the interactions are going to be different. You're not going to have kind of as much of a physical closeness, and it's going to be more challenging. So I guess just having very realistic expectations that you're almost going to need to get a little bit of reacquainted. I don't know if it puts your heart at ease. It puts my heart at ease that many of people living with dementia who are cared for by caregivers in my clinical practice, their behaviors and their neurobehavioral symptoms actually improved during pandemic. And I was kind of hoping that would happen, but again, I have very small practice, so I can generalize to everybody, but just what I'm seeing with my patients. When you have a very set routine, when you have very few people coming in and going, we know that this works very well for behaviors. So right now, even with introductions of masks and shields and and iPads, that's a disruption, but still many people are doing quite well. So what I recommend to my patients who are caregivers is take heart knowing that your loved one is doing well. It's much harder when they're not, and there's nothing you can do. But if they're doing well, if they seem to be content, just have realistic expectations for when you get reacquainted and give it time, and be prepared mentally that if a year ago, when was the last time that they saw you up close in person, they knew your name and they knew how you related to them. Right now, they might not. And it's going to take some patience and kind of time to kind of get to know each other and develop the relationship that relationship can be at this point in time, considering your loved one's cognitive impairment.
I guess I want to call out for people who might have a loved one who's in a facility that things are not going so smoothly. I know in many of the memory care and assisted living, nursing home care facilities around the community, there's been a lot of turnover during COVID, in part because of people getting sick, people losing their jobs. Administrations have often changed in facilities, which alters everything from the food preparation to the daily staffing routines and the schedules. And this has made it difficult for many of the caregivers that I work with to get a good handle on what's happening with the people they're caring for. There has been inconsistency in the quality of the care that people have been getting in some instances. So you have some staff who are really outstanding and excellent, and other staff who maybe are not as well trained or just don't have a good fit with the person that you love. And so I think you also have to be very patient and understand that the facilities are struggling to do the best that they can under these circumstances, and to continue to try to reach out and find people who you can communicate with and talk to, get the information that you want, and make sure that the person you're concerned about is getting the care that you think that they need, despite changes and upheaval that may be going on in the units. So.
Yeah, thank you for that perspective. It's hard to be watching that and struggling with how do you advocate and how do you show up for your loved one in your relationship, and then also be their advocate. So thank you for mentioning that, Sue. Um, a few people have asked questions about overnight. When you have a loved one whose behavior at night, climbing out of bed, having sleeplessness, creates a safety concern for the person, and then also makes it scary if you're the person caring for them and you're losing your own sleep and you're worried. Is there any, advice about monitoring persons living with dementia in the overnight, both for their safety and then also for the safety and well-being of caregivers?
It's one of the biggest challenges. It's a challenge that most care partners of people living with dementia at some point will experience. Eventually, many people develop the day-night confusion. And one of the most important set of interventions are really non-pharmacological interventions. So keeping your loved one as engaged and as active during the day as possible, making sure you have bright light. You really kind of want to over exaggerate. I like the use of full spectrum light in the morning where it really signals morning, where the lights are dimmed and you try to keep the environment as calm and soothing as possible. So darker lights in the evening, aromatherapy. But again, it's not a magical wand. And sometimes people's physiology just, interferes. So assuring safety is number one, using just like little safety locks on your doors where your loved one can just walk out is probably number one thing for your own peace of mind. But we have a world-renowned sleep expert in Sue Mercury here, so I'm going to defer to her to kind of advise on this area.
Well, I would really support what Tatiana said, that a lot of the secret to helping people sleep better at night is keeping them activated during the day. And that can be extremely difficult because if the person you're caring for is tired and wants to nap, you're trying to keep them awake is potentially going to get the two of you into a conflict if you're even able to do it. And that time where they're asleep during the day is also respite time, break time for many caregivers. And so it's hard to break these patterns of daytime sleeping and napping in the spirit of trying to keep people awake all day so they sleep at night. You might look at the possibility of, for example, if someone is getting out of bed during the night, being able to detect they're getting restless and getting out of bed sooner. There are sound and motion sensors, including things like floor mats that you can put next to the bed. So if someone steps out of the bed, you can be alerted sooner rather than later. So it doesn't get to the point where they're trying to exit the house. If they're at a fall risk, particularly, you want to know as soon as they're trying to get out of bed so you can catch them. You might try to see if there's any other things that might be activating or waking up in the middle of the night. So although it's true, someone that has, say, Alzheimer's disease, their neurobiology is changing, and that may be making it more difficult for them to have a normal sleep-wake pattern. But people with dementia also have pets that jump up on the bed, or dogs that bark, or sometimes, they're in a neighborhood where there's a lot of bright light coming in from the street, or street noise that might be awakening people. If someone is prone towards incontinence, they might have difficulties, they needing to get up to go to the bathroom on a regular basis, and that might be part of what's waking them up. So in some cases, if you can identify triggers for awakening that are modifiable, like light coming in from outside or noise, you can eliminate those triggers, and it reduces the likelihood that the person will wake up. That can be useful at times. If there's more than one person in the household, if it's, say, a daughter and her family, adult daughter and family who are taking care of mom who's also living in the same household, having people alternate nights that they're taking night duty. So it's not one person who always has to get up and care for mom if she needs attention, but that, they share that. That can be useful.
Great. Thank you both so much.
And to briefly reflect on the comments in the chat, yes, so the second line of therapy would be nutraceuticals or supplements, but I would strongly encourage you not to initiate those on your own. Always do it in consultation with a healthcare provider, because some even benign seeming supplements may have interactions with person's medications or have some influence on chronic conditions. But there are supplements that, if in consultation with your healthcare provider deemed safe, like melatonin, valerian, L-theanine, that could be very helpful too. In general, we don't medicate sleep issues in person with dementia, because the risk is much higher than the benefit. And we would only medicate somebody when their behavior is really putting them or somebody else at risk. And it's a very last resort.
Thank you both so much. We've had a few different questions from colleagues who are not primary caregivers, but might be coming in periodically to give respite to a primary caregiver. And so I'm going to ask a couple different versions of this, and there may be some themes in your responses. One person said that her family lives on the East Coast, and so they're planning for a trip to go where they haven't seen family members. Dad is the primary caregiver for a mom who has dementia. And so trying to plan for that trip to be as thoughtful and helpful and not disruptive in any way. And I know someone else in the chat you may have seen asked a question, lives a few hours away. And I think similarly, what can I be doing from a distance that's supportive? And when I can be on site, how am I introducing myself in a way that is supportive and not disruptive, especially given the isolation people have been feeling right now?
I would really encourage people to reach out, first of all, to look at the Alzheimer's Association. Online, they can give you links to where the closest chapter is to where the person you're caring for remotely lives. You can find out from them. They often have a social worker who's on staff 24/7 that might be able to give you information about resources locally. There's also something that used to be called Senior Information and Assistance, and they've changed the name. It's in Seattle, it's under Sound Generations. It's called the Pathways Information and Assistance Number. And you can contact these folks, and they have all sorts of information, again, about resources that are available in the area by the zip code and county that your family member and loved one is in. So I encourage people to find out what's available to help that way. In some cases, you can contact a geriatric care manager. The National Institute of Aging has an excellent website with information about what geriatric care managers do and how to find them. But they can often come to your home and sit down and help evaluate sort of what your needs are and help you, again, identify services that are available. And so these kinds of contacts are very useful if the person you're caring for and concerned about isn't close to home.
So those are wonderful resources. So to add to that, I guess I want to appeal to you, especially if you are one of the siblings who is living further away and not a primary caregiver, is to be very sensitive to a person who is providing majority of hands-on care, and to be there offering support, but to be very careful not to be distributing judgment, because if you're not there 24/7, you may not really fully understand what it takes to even get through the day. And I would just implore you as a long distance caregiver, first of all, to start from a very humble place of empathy. And it may look to you from the outside that you have all the answers of how care needs to be provided. And most likely you're right, but it may not be feasible for a person who is there by themselves, hands-on, without any other resources to do it. And when they feel judged or kind of looked down at, it's going to add to the burden and it's going to make it more difficult. So that's my kind of point number one. So humble empathy in approaching this situation. Point number two is person who is providing 24/7 care, we would assume is an expert in what works and what needs to be done. So if you're planning to come and visit, I would ask the family member who is there all the time, what works best for them. Do they think it would be best for you to stay in their home, or is it best for you to stay in Airbnb or hotel nearby? What would be less disruptive? What help and resources do they need from you? And I'll give you an example of a really beautiful way that we work with some of my patients to engage very big extended family. I have a patient who has moderate stages of dementia. He's a retired physician, and he would get extremely restless, kind of 4 to 5 in the afternoon, and has a lot of behaviors that developing delusions. Nothing works. Was tried on multiple medications. Those don't really work for delusions, and just really none pharmacological interventions work. But they have very big family, a lot of children, grandchildren, even great grandchildren. So we've set up daily consultation phone calls where somebody from the family is taking turn to get on Zoom with this gentleman for 20 minutes. And he was a psychiatrist. So they tell him about whatever life issues they have right now they need help with. He can't really meaningfully engage. He's not really giving therapy for them, but he developed a routine. He comes to his office, he gets his notepad, his wife turned on the computer for him, and different family members call in at the same time on a regular basis right before dinner, and he does his consultations, and his wife gives him a magazine and he highlights things in the scientific magazine, and it absolutely changed this gentleman's and his wife's quality of life. So then when family members were able to come in and visit, they seemed a little bit more familiar to him too. He didn't know quite who they were and how to place them, but they've had regular relationships. So this is just one of the examples of how to not very intrusively stay in touch, where you are very helpful.
Such beautiful creativity and care. Thanks for sharing that example. There's been, again, it's always, it says how important some of these topics are when I'm seeing them in the chat, and they also came in the questions ahead of time. And this is zooming out a little bit from a couple of folks who are asking, how do I know when a family member may be at the point where we need some outside support? Or what do I do when I start to observe behaviors that suggest my family member may not be able to manage all of their daily affairs on their own? And I'm not quite sure how to introduce that topic. Someone in the chat says how to navigate when a person is still sharp, but not aware that they're forgetting or what their limitations are. Someone wrote in, with Alzheimer's as a form of dementia, what are factors to determine when extra care is necessary for the person suffering from it? When is it no longer advisable for someone to continue to try to maintain independent living? So I wonder if you can each speak to that a little bit.
Well, in a perfect world, all of us with our families would talk about these things early. We would be saying to our mom and dad and our spouses, if something were to happen and you got to the point that you weren't able to be as independent as you are right now and to fully take care of yourself, what kind of support would you like? Would you prefer to think about moving into an assisted living setting? Would you prefer to have someone coming into the house and helping out? What would you like? How would you like me to talk to you about it? So that's in a perfect world. And if there's anyone that isn't in this position yet and has the opportunity to do that, I'd really encourage you to have these discussions early and often with family members. And, like I said, with your own spouses and your own children. Once a person starts to have difficulty, I think often family members are reluctant to talk to them because they're afraid that the person's going to become defensive and angry, and they might. And so you want to approach the topic with respect and caring, not in an accusing kind of a way, to come with specific facts of things that you're observing, that you're concerned about. I would always encourage people to make sure that the family member has a good medical evaluation, because sometimes the changes that start happening that are concerning to family members are because of a reversible, treatable problem that will become worse, but if treated, their cognitive difficulties might improve. But definitely, if a person is digging in their heels and they do not want to give up driving and they do not want to move and they do not want to have help, it sometimes, unfortunately, is the case that you just have to wait until things get worse. And there's some sort of a precipitating event, that often a medical event, that forces additional people to be brought into the situation and changes to be made. But uh, an older person has the right to make bad decisions. And unless they are an imminent danger to themselves or someone else, your choices are to try to use your best skills talking with the individual and trying to negotiate changes that you think are necessary, or just keeping your eyes open and hoping that it's not a disaster when something does happen that precipitates other people to be brought in.
And I want to chime in just a little bit to kind of continue on what Sue was saying. As a healthcare provider, I see it's my job to ask caregivers, care partners, when they first establish care, even if they establish care when their loved one is in the very early stages of dementia, is at what point would you consider institutionalization? Like, what would need to happen? What are non-negotiables for you? I will hold this for you. We will reevaluate it. So maybe when it's person becomes incontinent and urinates all over the place, maybe when person is falling down and we're not able to control to assure their safety. But it's really important to have this conversation early on when the emotions are not that high. And then for third party, it doesn't have to be healthcare provider, but I think it's helpful to kind of keep witness to that and say, hey, it's looking like we're getting there, you know, where are you at? What support do we need to bring in? And very quick statistics, we just finished another study where we looked at 100 people with dementia who were hospitalized in one of our University of Washington hospitals and their family caregivers. And we did a very in-depth study of the diet, and we learned that 23% of their primary care partners didn't pass the cognitive screen. So it doesn't mean that they have dementia, but they have cognitive challenges. And if they're the only person taking care of their loved one, now we have two cognitively impaired people. So as a child, you know, of parents, if you're suspecting that the care partner parent may have cognitive issues, this is when you offer to fly down, to come into medical appointment with them, and to very gently start having a conversation about your observations and about the importance of bringing in help.
Great. Thank you both again. I know that many folks who are in the Zoom room today have children. In addition to caring for a family member living with dementia, they're caring for young children. And so that adds a different level of commitment and different challenges for taking care of themselves as caregivers. And it also introduces how to help a child understand and engage with a grandparent, an aunt, an uncle, who may be changing and who isn't as available to them as they used to be, either because of COVID and then because of their cognitive impairment. Is there any advice or any information you might want to share with our, what, you know, the commonly called sandwich generation caregivers about navigating their unique world right now?
Well, there are a lot of books and also materials online that you can find that specifically address how do I talk to my children about grandpa who has dementia. I'd encourage people to check out some of those resources and find something that might be age appropriate for their children. One of the things I think is really important for us as adults with our kids who are dealing with older persons with cognitive decline is to teach them that the person is still there. I feel so strongly that when someone has dementia, even though their behavior's changing, their memory's not what it used to be, they may not act in the same way, they are still there. And the grandparent or the aunt or uncle that you loved uh, is still worth loving. And so you want the child to come from the perspective that's starting point. And then it's just a matter of helping the child understand that they have a disease, an illness, and sometimes they don't realize what they're doing or saying. So really try to normalize it. And many children, if not most children, I think, can really learn to adapt to that. What is more difficult, and probably some people in the room are more interested in that, is how do I balance taking care of, all the time demands, taking care of my kids who may be homeschooling, and I'm trying to take care of mom. And again, that sort of gets back to, I think, many of the self-care issues that Tatiana was speaking of earlier, is we have to pick our battles. Perfection is not the goal in parenting or in caregiving. You can only do what you can do in a 24-hour day. And so just continue to try to just do your best.
So well said. My only other addition is don't shy away from engaging your children and grandchildren in interactions with your loved one who has cognitive impairment. And right now you might need to be a little bit more creative because we don't want to subject our loved ones, to kind of physical presence of a lot of people. But there's a ways to be involved over the phone. There's a way to write letters. There's a way to be involved, on Zoom. And, as people become vaccinated and will be able to connect more. What a gift for children and grandchildren to learn the patience, to learn unconditional compassion, to learn how to interact with somebody whose world seems to be and behavior seems to be different from their frame of reference. So I think it can make your life as a caregiver easier if you find ways to engage your children and grandchildren versus trying to work so hard to keep them separate and to meet everybody's needs in their own. There's so many wonderful programs that started in Europe and right now spreading in the United States. They were spreading before the pandemic, where older adults with early to moderate stages of dementia would come into daycare centers, and they would be this perpetual grandparent who may not be able to really read the book, but they can kind of run around the rosy with the kids and interact and bring generations together. There are programs, very successful programs, where college students are living with older adults with early cognitive impairment. In exchange for free tuition, they provide companionship. So I think we can all emulate that. And I think that would take some burden away from feeling like you have to tear yourself apart by caring for these two camps.
Great. Well, we are getting close to the time of wrapping up. And I know there's been a lot of questions asked. If somebody chimed in with one more right now, we might have time to ask it, but we're getting a little close on time. Susan and Tatiana, thank you so much for being here. There's no pressure, but I just want to invite you. Are there any closing thoughts that, as you reflect upon what you shared at the beginning, the questions that have been coming up in the chat or that I've been asking, any closing comments that you want to offer before we sign off today?
I just want to say to people who are present on this call is I want to honor what an amazing work you are doing, even if it may not feel like it, from day to day. And I just really want to celebrate you taking on caregiving. This is not something that we planned for. This just happens, and we have to just jump in and say, I'm a caregiver, and right now I'm putting somebody else's needs and priorities over mine. With a child, it's different. You plan for it, you're excited, you kind of know you're going to give up your sleep, and other things, and you have dreams of how it's all going to transform when they're an adult. When you're taking on caregiving responsibility for an older adult, usually it just kind of springs on you. This is not something that we are training for. I think it's very honorable. I think it's very important. And I think you have to treat yourself with a lot of love and kindness, because if you don't give yourself compassion, it would be very difficult over time to maintain compassion towards your care recipient.
Yeah, that's really nice, Tatiana. I agree with everything you said 100%. I guess the one thing I would add to that is please don't do this work alone. No man or woman is an island, and we are social beings, and you need to have someone or someones in your life that you're talking to, that you're sharing and connecting with. That's so, so important. Many of the caregivers I see, even before COVID, they become very isolated. They're protective and defensive of the person they're caring for. They don't want others coming around lest they think poorly of the individual, or they don't want to burden family members or friends with their troubles. And that kind of isolation, just I mentioned earlier, we know now that social isolation is bad for people with cognitive impairment, and it's bad for caregivers too, I think. So please make sure you're not doing it alone.
Okay. All right. Well, again, I cannot overstate my gratitude, both to Susan and Tatiana, and my gratitude for all of you who made time to be here. Someone just put in the comments, I think when we envision this, we hope that this would be some self-care time for you, to be supported, be in community, to share with other people, and to benefit from the incredible expertise we have at UW. So thank you for being here. You'll receive an evaluation form from the whole U, and I really hope you'll fill it out. Your comments really do help folks like me plan future opportunities. So please use that when it arrives. And you have 4 more minutes before whatever you scheduled for your next day. And we've talked about those small minutes of being so important. So use them well, take good care of you. And again, many thanks for what you're doing at the university for your families. Take good care.